The case study I chose is an occupational therapist case study. According to the Australian Occupational Therapy Journal, complementary and alternative medicine in Australia dates back to the early 1970s, with the emergence of therapies such as osteopathy, chiropractic, traditional Chinese medicine, acupuncture, neuropathy, and homeopathy. The specific occupational therapy case study deals with the condition of lymphedema. This condition is where fluid builds up in the specific area of the body and tissues swell. This is caused by a compromised lymphatic system. The system is a key part of the immune system, draining excess fluid from bodily tissues and organs and disseminating white blood cells to help fight infection. The Australian Journal also says choosing the appropriate treatment for lymphedema can be confusing for patients as there are multiple methods, some that have questionable effectiveness, and a range of practitioners. The client we are calling Mr. C had a traumatic work injury sustained 20 years earlier. He says he was crushed by a crane and electrocuted. This resulted in thoracic outlet syndrome, right ulnar neuropathy, right carpal tunnel, and a right frozen shoulder. Also, lymphedema in the right hand. Mr. C had previous treatments. They included physiotherapy, laser heat, a compression glove, massage, and bandaging, and all had little success in his treatment. His hands still remained puffy and swollen. His complaints and symptoms included swelling, pain, heaviness, tightness, stiffness and tingling, and limitation to perform daily activities, and limitation of movement. The occupational therapist observed that the skin was dry, cool to touch, and shiny. Also, he had sensory loss and numbness, soft pitting edema across fingers, hand, wrist, and his forearm. Given the lack of success with past treatments, Mr. C requested to try alternative and complementary medicine to draw out the fluid. Occupational therapists felt that the consumer should be actively involved in a more collaborative plan. The treatment plan included using cabbage poultice and clay in order to draw out Mr. C's fluid in his hand. Mr. C found the information in a book titled The Nature Doctor by Alfred Vogel, published in 1952. The book advised that simple swelling or bruise responds well to the treatment with cabbage leaf poultices. If these prove to be too strong, alternate with the clay pack. Mix the clay with the infusion or horsetail or any other herb for a better effect. Alternating the poultices from one day to the next is beneficial because the clay reduces the swelling and cabbage leaves contain healing properties and also draw out toxins. This double action ensures a rapid cure. From 11 a.m. to 1 p.m., Mr. C applied clay mixed with 2 tablespoons of rainwater. Overnight, applying cabbage poultice directly over the skin and covered with a cloth and an old low-stretch bandage. The treatment resulted in increased movement in fingers, wrist, elbow, and shoulder, reduced pain, improved skin condition, and improved the ability to function independently, including the ability to hold a spoon while eating. After 2 weeks of alternative and complementary medicine, Mr. C was fitted with a custom-made glove only to be removed during showering and swimming. Additional exercises included a yellow resuscitative foam and tendon gliding exercises for strengthening Mr. C's hand, and also foam tubing to assist with culinary and handwriting. Overall, I believe that the treatment was a success and worked much better than past treatments. I think the healthcare providers should encourage their patients to introduce complementary or alternative therapy because some things may work better than others. If Mr. C never discussed what he found in the book Nature Doctor, his hand may have stayed swollen and painful. This occupational therapy case study identified the need for further research in complementary medicine, for example, cabbage and clay, because there is currently limited information and evidence supporting its safety and effectiveness. Thank you.